talking about depression and anxiety in multiple sclerosis and how to recover. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. Many people that are diagnosed with multiple sclerosis suffer with depression and anxiety. It's really common in multiple sclerosis. And the treatments that we have would be to use like different medications to manage this condition. But I'm going to share a lot of truths about trying to manage this condition and how it actually makes matters worse. And I'm going to also share with you that it is possible to recover from anxiety and from depression and from multiple sclerosis when we treat the parasites that cause MS, depression, and anxiety. So if we haven't met yet, I was diagnosed with multiple sclerosis 35 years ago, and it's almost going to be 36 years ago. But when I was diagnosed, luckily I didn't have a lot of depression, but it's really, really common in people that suffer from multiple sclerosis. And so if we look in the world of standard of care for MS, they don't know what causes MS and there is no cure. And again, with depression, they just say, well, it's just part of multiple sclerosis. There's really nothing you can do about it. You can try to, live healthy life, but take antidepressants. And current research shows that actually anxiety is even more common in multiple sclerosis than depression. And people that have relapsing remitting MS, they actually have higher numbers of depression and anxiety than progressive multiple sclerosis. But because progressive multiple sclerosis is like the symptoms are a lot stronger and they persist longer, they come on suddenly and you don't get the breaks. The prevalence, so like the percentage of people that have primary, or I should just say progressive multiple sclerosis. So the people that have progressive multiple sclerosis, they have a higher prevalence of depression and anxiety. And so how we treat the anxiety and the depression is what we do is we use we are prescribed antidepressant drugs. And there is a really major concern about using antidepressant drugs because they can actually make MS symptoms worse over time. So this has been well documented. And it's crazy at this point in time that we still have no standard way of treating depression and anxiety and multiple sclerosis. And an FDA clinical trial showed that the rate of suicidal tendencies or thinking or behaviors doubled with the use of certain antidepressant medications. So there's a lot of problems with the treatments that we have. Just want to make sure that you guys, I'm just going to check to make sure that I am live here. Let's just see. Yes, awesome. All right, so the problem that we have is that depression and anxiety are really common with MS. And if we take the treatments that are recommended for treating the depression and anxiety, they have horrible side effects. They can actually make our MS worse. And so increasing studies show, so now we're going to step into, like we were talking about the depressing part, and now we're going to talk about the, like really what's causing the depression and anxiety and how we can recover. So more and more studies are showing that dysbiosis is associated with the onset and progression of depression and anxiety. And that really is involved with the gut-brain axis. I've talked about the gut-brain axis in the past, but what's really important to know is that even though our standard of care, they tell us that they don't know what causes anxiety and depression and foggy head and fatigue, all of that, but the research, science is showing that gut dysbiosis is really associated with depression. But we also know that's associated with multiple sclerosis also. And they're really excited about potential different types of new therapeutics where they're going to use microbes or they're targeting microbes. So this is the up and coming research of where we need to look for solutions, but we have a lot more solutions than what they have available right now. So they talk about how diet and fecal transplants and probiotics can definitely improve um, anxiety and depression. So, with respect to the research, like we know that in the world of science, there are trillions of microbes that live inside of our body, especially in our digestive tract. This would include things like bacteria and worms and protists and fungi and just possibly viruses too. And so recent studies are really showing that the microbes that live in our gut really can impact different parts of our body. And I've shared on one of our previous studies and live events talking about the brain gut axis. So, whatever happens in the gut can really impact many other parts of the body, including the brain. And there has been anecdotal evidence that there is an observed increased risk of depression and anxiety after the use of antibiotics. So, this has been well documented in science. And another recent systemic review of scientific studies showed the association between antibiotic use and subsequent development of depression. So, that's more evidence showing that when our microbes are out of balance, then we are dealing more often with depression and anxiety. So, the gut microbiome is involved in depression and anxiety and all kinds of other cognitive function. And they also have found that an unhealthy diet and environmental exposures can really impact the gut microbiome composition. So, the types of microbes that live in our body. So, diet is really important, and we know that. It has also been, so our diet has also been linked to depression, like a bad diet, and other things that would affect our microbiome. And then, so when we have more of, like, there's certain bacteria, certain microbes that they know are pro inflammatory, and there are certain bacteria that they know are anti inflammatory. So those would be the good guys. We want to have them in our body, in our digestive tract. But they have found a link consistently in research where when we have systemic and gut inflammation, that further causes inflammation with depression. So basically, what they're saying is that when we have inflammation in the body, that really triggers depression. All right. So the more inflammation we have, that can really impact depression and anxiety. So there are certain types of bacteria that are involved with depression. So Bacteroides and segmented filamentous bacteria that will increase our susceptibility to depression, certain mycobacteriums, and Morganella is another type. So these are just a few microbes that are associated with depression. When they find more of these different types of microbes in our digestive tract, we have a higher incidence of depression. And then also they have found that gut dysbiosis, like fungal, so it's not just bacteria, but fungi is also documented in depressed patients. And so Candida albicans, you may have heard of that. So there's a lot of scientific research showing that various types of pathogenic or inflammatory, inflammation-causing microbes, they are increasing our susceptibility or the incidence of depression. So there are many, many studies that show this. And what I don't understand is, like, this took me literally like a couple of hours to pull up a little bit of research on this. So why is it that the MS Society doesn't talk about this? Why is it that our doctors don't talk about this when there's this whole plethora of research really showing that dysbiosis is really linked with depression? So that means our microbes are out of balance. We have too many disease-causing microbes. We have a lot of inflammation, and inflammation is associated with also with the depression and anxiety. So there are many important mediators involved in the gut microbiome host. interaction. So between the microbes in our body and us, the interaction. So it's not just the bacteria and the fungi and the worms that live in us and cause inflammation and cause more of the cognitive problems and mood issues like depression and anxiety, but it's also the poisons they produce. So the microbes themselves and also the poisons that they produce. And and it's not just poisons, but they can produce neurotransmitters. They can produce all kinds of different substances that will change or impact our physiology inside. It's really, really, really complicated. And so different metabolites, so there's toxins and metabolites, and the metabolites could be neurotransmitters. So for example, neurotransmitters produced by the gut microbes, they directly or indirectly can influence our emotional behavior and things like, so neurotransmitters like serotonin and gamma aminobutyric acid. So those are a couple of neurotransmitters. And there are other metabolites or other substances produced by microbes that are associated with the causing depression. So there's lots. There's lipopolysaccharides, lactate, and B vitamins also. And so the increased systemic translocation of gut metabolites, so the metabolites moving into different parts of the body, and also microbial cell components, or even the microbiota. So whether it's components from the cells, their metabolites, or actually the microbes, they can travel through the intestinal wall when we have leaky gut, right? Because when we have too much inflammation in the gut, we can end up with leaky gut, and then these things cross the blood or cross into the blood. They can cross the blood-brain barrier and directly impact our brain. So this is another really important. So the microbial signals and depressive emotions can increase the synthesis and release of cortisol. So if we have, like, if we're feeling really depressed, that can increase our cortisol, but also different substances produced by the microbes in our body can produce more cortisol, and excessive levels of cortisol, which is like a cortisone in our body, it promotes gut pathology by modulating intestinal barrier function and inflammatory responses, resulting in leaky gut. And the mitochondria is also involved. So I hope you can see just by sharing a little bit here how involved this is. So it's the microbes themselves that really impact inflammation, and inflammation is really involved with depression and anxiety. So if we have a lot of inflammation, we can have a lot more anxiety and depression. But then it's also the microbes' metabolites, is the poisons, the molecules, the chemicals they produce can really impact many different parts of how our body is functioning, causing leaky gut, causing depression, the neurotransmitters, changes in cortisone released in our body can impact mitochondrial function also. And so drugs, especially when they're taken orally, they can really have a significant impact on the types of microbes that live inside of us. So even the antidepressant and anti-anxiety medications, they can really impact the microbes that live inside of us. And interactions between drugs and our microbes in our body can alter the bacterial metabolism and even the activity and the efficacy of the pharmaceuticals that we're taking. So there is evidence that antidepressants have antimicrobial effects, especially on gram-positive bacteria. So it's not just the antibiotics that impact the microbes that live in our body, but it's also the other medications that we take that we don't realize that they can be altering the types of microbes that live in our body, and all of this is linked with depression also. And then also there, as I mentioned, if you just joined a little bit later, what's really awful is that when we have depression and anxiety, when we have MS, we are prescribed antidepressants, which can actually, it's been documented that they can make our MS symptoms worse and they can cause suicidal tendencies. So make sure that if you are dealing with depression and anxiety, make sure that you check with your pharmacist or go online and start to read up on the adverse effects of the medications you're taking, because sometimes you can find an alternative that's not going to give you such horrible adverse effects. So sometimes we can be so depressed and we're taking a medication for that, and then it can make us feel even more depressed. So just be really careful with that. And it can make our MS symptoms worse, which I didn't realize that, but that's been documented in the research. So data suggests that antidepressants alter gut, the types of microbes that live in the gut and their function. And that may also explain part of the antidepressant effects. So due to the effects on the microbiota, of so due to the effects of microbiota on drug toxicity, the chronic use of most drugs of all categories potentially causes various adverse effects in many patients. So this could even include things, increased risk for diabetes and obesity and gastrointestinal symptoms, cardiovascular disease. So if we are just going to be diagnosed with MS and we suffer with depression and anxiety and we just decide to take some more medications, we're not going to be happy. Like it's just going to make matters worse. You can try it, but I'm sure that you're not, because I've worked with hundreds and hundreds of students and they have come off their antidepressants, and that's the really important part of this call. I apologize for being late. I had some really bad technology issues. I didn't think I was going to be here, and that's why I was late, which doesn't happen. It hasn't happened for a very long time, but unfortunately couldn't get on. Was here waiting, but I could not get on. So the gut microbiome is dynamic and diverse. We know that there are thousands and thousands of many different types of species of microbes that live in our gut. It's changing. There are many things that impact what kind of microbes that live in our body. And we know that diet is so important to have a healthy gut microbiome. We also know that the overuse of antibiotics has devastated our gut microbiome. But through the research that is current, we see that other medications, not just the antidepressants and anti-anxiety, but other ones will also impact which microbes are living in our body. And so in the research that I looked at, they're quite excited about, like, okay, so like the antidepressants drugs are not working, the anti-anxiety drugs are not really working very well. Maybe we could look for some new therapeutics by, somehow manipulating the gut microbiome, and at least they're moving into the right direction. I wouldn't hold my breath because they would like to have patentable things we take forever. But through different research, they found that, giving people fecal transplants and probiotics, changing their diet, they all helped to decrease the depression and anxiety symptoms. And now I'm going to share with you what we do in the Live Disease-Free plan to recover from not just depression and anxiety, but also all the other MS symptoms. So before the parasites are treated, it's really important. So the infections that are causing the depression, the anxiety, the foggy head, the poor memory, the pain, the fatigue, all of that. So before we treat them, it's very important that we prepare, because when we have a chronic disease like multiple sclerosis, we're very toxic. We've got a lot of parasites inside of us. We've got a parasitic infestation. There's a lot of different chemicals that they produce, compounds that they produce. So our body is overwhelmed. It needs help. It needs support. So the first thing to do is to get ready to treat. If you are really, really sick and then you want to just treat infections, it's very different than just treating strep throat or tonsillitis or bronchitis or like a bacterial infection. When you're dealing with a parasitic infestation, we're dealing with different types of parasites, and we're dealing with high numbers throughout the body. So number one is we follow the Live Disease-Free diet, which is low carb. All like bacteria, fungi, worms, protists, they all love carbohydrates and simple sugars. So when you decrease those carbohydrates and simple sugars, you'll notice that the parasites are less active. You won't know that, but you will notice that your symptoms start to get a lot better because there's less inflammation. There's a decrease in inflammation. And that is because the parasites are not as active. They're producing less metabolites, less poisons. And then we start to notice, oh my gosh, I'm starting to feel better. I'm starting to feel a little happier. I have a little bit more energy. I'm not feeling quite as stressed. So, diet is huge if you get your carbs low enough. That's the first step. And the second step is supporting the body. And so this is a multi step part where we make sure we're having daily bowel movements. So we're getting the toxins out of our large and small intestine. We can take a binder, which helps to suck up the poisons that are in our digestive tract to carry them out. So we're decreasing the poisons, we're getting the toxins moving out. We're not allowing the microbes to grow as quickly because we're not feeding them as much. And this, again, we notice more symptom improvements. Another really big thing for depression and anxiety is getting enough sleep. So when we have parasites, we don't sleep well. We might have a hard time falling asleep. We might wake up several times throughout the night. And then we might be going to bed too late. Some of us are just getting a few hours of sleep. That'll make your depression and your anxiety, your brain fog, all of it a lot worse. Your memory, etc. So very important to be getting enough sleep. And some of our students need to use over-the-counter sleep aids to promote sleep until they're starting to treat. So before our students treat the parasites, they are, number one, getting the carbs down. They're feeling a lot better. They are having daily bowel movements. They're sleeping at least 8 hours per night. They get their basic blood work done. They're supporting areas of their physiology that need it. So maybe it's thyroid function, maybe it's adrenals, and adrenals can be really linked with anxiety also. So, and there's some certain supplements we can take to support depending on how stressed our adrenals or depleted they are. So, all of these things are really important before we start treating. So, before we start treating, we should notice that the depression is really starting to lift and we're starting to feel a lot happier. We should notice that we feel like we can cope, we can handle things better. There's other things we can do to really help to promote, less depression and less anxiety. So things like, before bed, just make sure that we are off the blue light as much as possible, at least 2 hours before. But doing things that make us happy. We're living in a very stressful world. So right now, if we're diagnosed with MS, that's very depressing and it's very stressful. And then if things are going on in the world around us that are very stressful, so we have to intentionally set aside time where we are nurturing our soul. We are just helping to bring the cortisol down, bring the stress hormones down. And we can do that through, like, singing is a really great one, watching something funny or having a good laugh with somebody. So laughing and singing are two wonderful ways. Just my faith is huge. So if you have a faith in God, spending time in prayer, meditation, reading the Bible, reading whatever inspirational information books that you have, that can help to settle and peace. So it's not just only about popping supplements, but it's also a combination. Sometimes our loads can be so heavy, and we just literally have to visualize taking all of the stress we have and just setting it down beside our bed, right? Giving it to God, and then just literally letting go of it and just saying, I'm giving myself a few hours to let it go. So all of this is a combination of mindset and being mindful and doing practices that really help to make us happy. So, spending time with loved ones, spending time in nature, as I mentioned, singing, watching a funny show, catching up with some good friends. So, bringing that intentionally into our life. And I know a lot of us are homebodies, we're isolated because of disease, but you could pick up a phone, right? And there are people that you possibly would come by and visit you, right? Or take you out. So you have to really reach out, and even if you don't feel like it, and do that because it'll fill your tank. It'll make you so much happier. And then as far as the anxiety, again, you just have to be really aware. And there's some great supplements also on our website. There is Ortho Adapt, Ortho Adapt, and you can find a similar product to that one on livediseasefree.com. There is an Ortho Adapt supplement. I think there's a thyroid supplement there also. And that company is great. And so it'll have certain nutrients and sometimes glandular extracts to really help build up our adrenals to support them. And that can also really make a big difference with anxiety. So these are all things that we're doing before we're treating. And so by the time we're ready to treat, we should be starting to feel a lot better already. So we don't, and then also our students that are on antidepressants and on anti-anxiety medications, when they start, they're researching the medications that they're on. And if they're not feeling comfortable with the adverse effects, if they feel that it's doing more damage to them, they talk with their doctor and their pharmacist and they ask, what is the safest way to come off of this? But they do that when they're feeling a little better also, right? Because they don't want to just come off of it and possibly feel worse. But with some medications and some antidepressants, you have to come off very slowly so that you don't crash. So the diet and supporting the body are the first steps, and you should be feeling a lot better with less depression, less anxiety, less fatigue. One of the biggest factors is people get up less to go to the bathroom at night. They don't have to go to the bathroom as often. Maybe instead of 5 or 6 times, it's once or twice. Then they're sleeping better, right? And sleep is really important for your adrenals, for your immune function, for your brain health. So sleep is really, really important. All right, so when we get to the treatment part, we have to realize that it's not just bacteria or viruses. I know viruses are trying to pin it on viruses all the time, but there's very weak research in that area as far as causing a lot of the symptoms of MS. But what we have found is that it's very important, and the worms, like the bigger worms, can cause so many symptoms of cognitive problems, so the depression, not feeling like you can cope, anxiety, etc. So it's not just the bacteria. Just consider that when we're really, really sick, we're infested, we're out of balance, we have too many multiple types of microbes, and that's why we do treatment cycles where we're knocking back or treating the larger worms and protists, then we're knocking back candida or molds, the fungi, and then we are taking a break week, and during the break week we're using more of the herbs and oxygen type therapies to treat some of the smaller ones where we continue to treat bacteria and different types of fungi. And that would be one treatment cycle. It's approximately 1 month. We love herbs. We love the oxygen therapies, but we have found they're just not enough on their own to recover. So that's why we have also incorporated the parasite drugs, and it makes such a difference. Like, like we're not thinking that we could have big worms, but I have personally passed really large worms, and a lot of my students have too. And it's absolutely shocking how your mood changes when you pass them. It is really, really shocking. So please be aware that it's different types of parasites that will cause depression, anxiety, and impact our mood in many different ways. So again, when we're treating them, we not only notice that our mobility is better, our strength is better, spasticity goes away, drop foot can resolve, people can come out of wheelchairs, people find themselves not needing walkers or canes again. The stiffness and spasticity subsides, balance returns, tremors diminish, pain ends, people can write again, like with their pen and paper, their vision improves, their speech improves, strength returns in their legs and arms, but their brain heals. We've had several students that were really, really cognitively impaired, and some of them in brain studies. And once they treated the parasites, all of that was gone. The depression, the memory issues, anxiety, fatigue, all of it gone. They could think, they could remember, and above average. So it's really exciting that the brain can heal, but it really needs support. And the sooner we treat the parasites, the easier they are to treat and the quicker we recover. It still takes work, but you can imagine that if you don't treat parasites for years and you become more and more disabled, then it's a much deeper problem. It takes more time and there's more damage. If a nerve has been permanently damaged, we don't know how to correct that. But if it's still in the inflammation stage, we can correct that. So then once we have treated really well over a few treatment cycles, so if somebody is newly diagnosed, they might need 3 to 6 treatment cycles, maybe more like 3 or 4 or 5. And then if somebody's had multiple sclerosis for many, many years, they may find that they're treating for a year to a year and a half, but they're improving month after month after month. And it's shocking how much recovery we can have that we didn't know. So this is a way, the Live Disease-Free plan is a way to overcome our depression and overcome our anxiety, to feel like our old self again, where we feel happy and we feel playful, and we make plans with friends and we joke around with them like we used to, that we can handle stress, right? When you have anxiety, you feel like you're going to die. And I've been there many years ago, and I couldn't even watch the news because I felt like I was going to die. But when you correct your microbiome and you get rid of the toxins, you get the inflammation down, all of that goes away. And that is the answer, right? And then you're trying to build back the good microbes, and so you're eating foods that will feed them. They love fiber, so you're bringing in fiber and nutritious vegetables, low carb but nutritious vegetables into your diet. And so you're helping to build back the good microbes, the ones that are anti-inflammatory, and you are getting rid of the inflammatory microbes. All right, I'm going to go to a few of your questions, see if you have any. So I apologize for being late. It was a very frustrating situation. So D, you think part of the anxiety is not being able to keep up with the daily activities? Yes, absolutely. So I didn't even mention that part, but when we're diagnosed with multiple sclerosis, it's very depressing. It really takes away our hopes and our dreams, because they tell us that there is no cure for MS. They don't know what causes it, and there is no cure. So if there's no cure and they're telling us we're going to be disabled, then we really, really lose our hope. We lose the vision for our future, and it's incredibly, incredibly depressing. And also, like what Dee was mentioning, the anxiety of you just can't do what you know you should do. And then there's so many things, and I didn't want to harp on that because you guys know how awful it is. You know what you're dealing with. But the exciting thing is things can change really quickly. I challenge all of you to just even start with the Live Disease-Free diet. It is listed on our website, livediseasefree.com, underneath resources. I believe that's what it's called in the main tab. Click on that and you'll see the Live Disease-Free diet. The guidelines are there. There's some videos on what I eat for different meals. So go through that and just focus on getting your carbs as low as possible. The sweet spot seems to be between 30 to 40 total grams of carbs per day. So Dr. Terry Wall's diet, her Paleo Plus, is definitely more helpful for sure, because it is the lowest carb that she has, and people, especially with progressive multiple sclerosis and even relapsing remitting, they notice significant improvements when you're decreasing the carbs. So ours is a little bit more fine-tuned. We're not having smoothies. We're not having chocolate or wine in the recovery phase. I know it's hard to give up. It's worth it. It's so worth it. But if you get the carbs, and you can check your work by using the Chronometer app, which is a free app on your phone, you can get the carbs low enough. You will notice within 1 to 2 weeks, you should notice some significant symptom improvements. If you can get your carbs down to around 30 total grams of carbs, not net, but total, this is where you start to notice lots of symptom improvements. So that is something you can do. And I have people all the time that I'm not even working with yet reaching out and saying, oh my gosh, the diet has helped me so much. And then they want a treat. Hi, Bonnie. You're very welcome. Hi, Dolores. So has some of the people got their vision back after optic neuritis? It really depends. It really depends. If you've had optic neuritis very recently, if you're going through it, the quicker you can turn it around, then definitely you can get vision back. But for me, like, I had a severe case of optic neuritis. It was like complete blackout for 6 weeks, like that. And this was back in 1988. It was so severe. And because I didn't know all this information back then, I did not know how to turn the inflammation around. So I have permanent damage to my left eye. And luckily, nobody can see it. It's in the optic nerve. So basically, if I closed my right eye, I would not be able to drive because I would not be able to see. It's kind of the center of your vision gets cooked. But if you're just going through optic neuritis, yes, there are many things that you can do to really get the inflammation down as quickly as possible. And but we have had a lot of people that had vision issues and their vision improved tremendously. So one of our students, Graham, years ago, I still remember him clearly, that he was at risk of losing his license. He had been booked in for an exam, an eye exam for his driver's license. And just within maybe 5 weeks of being in the program, his vision improved so much that he got to keep his license. We've had lots of people sharing that their vision improved. Even things like, if you have prescription glasses, we've noticed that people need to decrease their prescription to make it like not as strong of their eyeglasses, so because their eyes improve so much. So yes, vision can improve, but if it's been a severe case of optic neuritis, that may not improve. It's individual. Whatever, so like things like floaters and all of that can definitely be resolved for sure. Let's see here. So Vicky, hello. You did the protocol for 3 weeks. You coughed up a dead worm. uh, and I'm not sure what. So the thing is, I don't think that you are one of my students because we don't really work like that. There's a really big growing interest in using parasite drugs. Like there's a lot of people that are becoming aware that parasite drugs cure cancers and that they help us with many different diseases because all diseases are infectious diseases caused by parasites. And a parasite can be big like a worm, it can be small like a protist or bacteria or fungi. So there are a lot of different forms and different places where people are, like they're trying one drug, they're trying another drug, they just hear of a dosage and they try that dose. I wouldn't recommend that because number one, if you don't take enough of a treatment, the parasites become resistant. And if you take too much, you can hurt yourself. And what we have observed, even just with any chronic disease students that we work with, it's not just MS, they test well for 3 to 5 parasite drugs. So if you're just taking one and you're taking suboptimal doses, you can be making matters worse in the future because it will impact your gut microbiome even further, and you may not be using even the treatment that you need. That might not be what you need. So you should work with somebody. You should learn, like that's what we do is we educate people, we teach them. I've worked with doctors, I worked with pharmacies, we've worked with hundreds of students from probably close to 20, at least 20 countries by now. And so when you actually use the right doses and the right combinations, and again, the parasite drugs on their own is not enough. We could not recover from MS just with using the parasite drugs. We use a combination of oxygen therapies, the parasite drugs, and the herbs. So D, I need to get help with the veggies, eating more. So a lot of people that are sick, and just even people in general, they're not used to eating a lot of vegetables. But what we have found is that, even teenagers or young adults that say, I hate vegetables, if you just give yourself a little bit of time in the following the diet, you'll love them. Your taste buds will change. And so watch some of my videos that I've done on YouTube. There's a playlist for the Live Disease-Free Diet, and there's also on Facebook, but also on our website. You'll find lots of information about the diet. Yes, the Chronometer app is a free app on your phone. D, that's awesome. All right. Okay, so what I'm going to do is I'm going to let you guys go. And I apologize for being late. I will definitely make sure that that doesn't happen again. I'll have to go on earlier. The program I was not able to get into. It has a very a difficult way of getting in. But I hope that this gives you hope that You do not have to live with depression and anxiety or even multiple sclerosis or any other chronic disease if you treat the cause of why you're dealing with these symptoms. And that would be the cause is a disruption in the microbes that live in your body, dealing with dysbiosis, dealing with too many parasites and not enough health promoting microbes. And when you correct that while following a holistic approach, you can recover. We have so many people that have recovered every week in the Live Disease Free plan. We have so many students that are sharing their successes as they are recovering from these parasites. It is so incredibly exciting. And I shared last week just a few students, like I did a live event last week where I was talking about, like, why are we stuck in this paradigm? Why can we not move forward with MS research? Why are we not doing meaningful research? Why are we just stuck with, looking at the MRI lesions and looking at antibodies in the spinal fluid? That's it. We've never moved in 40 years. We're just stuck there. And that is because there's a lot of money involved in being stuck there. But on that event, I shared 4 students that, like, years and years later now, probably 7 to 10 years later, they are on with their life. They're doing amazing things and they've recovered from MS, and you can too. But you have to take a different path. You have to do something different, and that is using a different approach. And that is the Live Disease Free approach. So if you're new to this, watch my videos on YouTube, Facebook. I got tons of them on there. But more importantly, go to our website, livediseasefree.com. Our blog posts are very amazing. They will really make you think. They will really educate you on, what you're dealing with, why we're in this situation, what you need to do. You'll see lots of big worms that our students have passed if you want to see them. And then when you're ready, if you need support, if you're like, okay, I got it, I know I'm dealing with parasites, then reach out, watch my masterclass training, and then you can book a time to chat with me and you can make sure that the Live Disease Free plan is a good fit for you. And then I would be honored to support you. So if you find these talks, these live events helpful for you, the information is helpful, make sure to like and subscribe and share this with other people. Let's get talking. If you know somebody who's dealing with depression and anxiety, they don't have to. Make sure to give this information to them and have a wonderful week. Take care and bye-bye for now.